it's great to have a great partner like Secretary King in terms of the interaction of education and health, and how we are dependent on education, and education is helped by health. And so making sure that we're making those ties and connections to move children along and their families in the ways that they should be. So we're excited today about continuing that progress and making progress on those children, because 3 out of 4 of those uninsured children walk through a school door. So when we think about reaching the uninsured, and it's something we think about a lot, while the number continues to get smaller, and we're pleased about that, for the first time in our nation's history, there are under 10% of the nation uninsured, and that's a record for us as a nation, but that last 10% we've got to get to. And when we think about the children, this is the place where the children are reached, and this is the place where there are trusted voices. And the other thing that is very important in terms of thinking about schools as a place where we can help with this uninsured problem is the parents' trust.
Yes.
So, and we're going to we work together on open enrollment, and so today we've talked a lot about Medicaid and CHIP, but it's also a place where for those who have parents and children that wouldn't be eligible through those programs, making sure that they access the marketplace. And that's a part of that, not just asking the question, but going the next step. If the answer is no, then what do you do to get that insurance? And then there's the other step that's also very important, and I'll look forward to hearing from those who are participating, and that's moving from that insurance coverage to care and making sure that people access that care, because we get the kids, and this happens not just for children but for adults. People get enrolled, but then because they haven't had care before, they don't actually know how to access it. For many people, the emergency room is the means by which they get health care delivery. And now they need to learn and understand that there are free preventative services, those kinds of services that can prevent things. So we think that the school is important across that whole continuum of learning if people do or don't have coverage, helping them to get that coverage, and then helping them to be educated to use that coverage so they advance their care and we get the actual outcomes